Let's talk about the next generation technologies in the healthcare. As a breast cancer specialist, you have been working a lot of technologies. What do you think in the next decade technologies comes in your mind which you want to highlight that can be a game changer and it will be revolutionizing more?
As you know, Ali, like the issue with healthcare is that the data is so complex, right? There's so many different parts of healthcare systems. So one of it is text, right? Like it's your electronic health record, blood tests. So genomics, proteomics, the multiomics as they talk about, your radiology reports and your radiology images, your pathology if needed, if some tissue samples are taken. So there's just this vast array of applications that AI can help with. But we can highlight a few. So I think something that we can all relate to are wearables, right?
Yeah.
Wearables such as the
Innovative.
Apple Watch or the Fitbit that's able to in real time track, for example, your heart rate and your heart rhythm. There was an example where a patient was wearing it and the Apple Watch detected that he had something called atrial fibrillation, which he never knew that he had before. And he was able to go to the hospital and get the care he needed because you can be at increased risk for stroke, for example. So imagine
Yeah.
this wearable that will send you a little alert if your blood pressure is up, if there's some abnormality in your vitals, your heart rate, your temperature. So that's like going to be a huge game changer. I think the second part is, I think we discussed this, which was the infusion pumps. I think this is just such a key element in healthcare in general, and especially in hospitals. And imagine being able to have an infusion pump in your home that's able to be tailored with an AI algorithm in real time to deliver medication as your body responds to it, or be
Yeah.
able to tailor your chemotherapy regimen, for example, or
Yeah.
how your insulin is delivered in real time. I mean, we already have pumps like this, like this Dexcom, for example, and
Yeah.
BDLRS, which is able to also prevent medication errors.
Yeah.
So the BDLRS is actually even connected to a drug library and able to make sure that the dosages that are administered to patients are actually within compliance. And I
Mm.
think they were able to mitigate 300,000 medical errors within 2 years
Mm.
in one of the hospitals implemented. So, I mean, that's a huge game changer, right? When we go to radiology, for example, which is kind of my favorite topic, again, the ability of AI to be a second pair of eyes, it's already here. The Lunit, the Transpera, like we talked about, I mean, being able to highlight areas that you might miss on a bad day or something so subtle that even your eye can't see it. This is real and this is happening now. It's decreasing false negative and false positive rates. It's enhancing cancer detection. And these are incredible applications. And I think in the future, there are so many other applications. So, for example, in surgeries. So, right now, I'm sure you've heard of the Da Vinci robotic system. We
Yeah,
actually,
I'm so excited to
yeah,
listen about that.
I
How
mean,
is
it's really incredible. So we already have that actually at my hospital where I'm working in Dubai. We've done thousands of operations with it, and that's where the robot itself and the robot arms is controlled by the surgeon in real time and
Hmm.
able to do very fine tuning to surgical procedures with enhanced outcomes and improved recovery times. But imagine in the future being able to do the surgery in a remote area in a country with a
It's
surgeon kind of hundreds of thousands of miles away. And we're not talking about simple surgeries here. I mean, actually, recently we conducted at the hospital a Whipple procedure, which is one of the most complex cases where the pancreas is actually removed. And it's a very, very complex procedure. And it was successfully done at the hospital here. So I think the next generation of this will be being able to do this remotely in a safe manner, making sure the connections are stable enough to be able to do so.
robotic surgery is something is now nowadays going on, and I'm very excited, to see how
Yeah.
transforming it is. And as you mentioned, that the real time connection should be really vital for that in this decade. How quickly it comes to the market and how revolutionized it is. Next 10 years, I think this technology will create a huge impact, and the way AI is going, so it will integrate with AI.
Like you said, with telemedicine and all of these new technologies, it won't be that healthcare is coming to you. It will be that healthcare is already here with you. So that
Yeah.
it's just a day-to-day practice in our lives that, obviously I'm very, very passionate about preventative health, right? Imagine
Yes.
being able to predict your risk of developing heart disease or high blood pressure or cancer in the future, getting an alert and making sure that you get all the tests that you need early. You get all the blood tests that you need as early as possible. It kind of of this idea of anticipatory care and preventative care. And
Yeah.
I think that's really the future in on all of AI technology.
So I just want to ask in terms of adaptability for having these technology,
Mhm.
and so how important it is in terms of efficiency wise. Will it enhance your efficiency being a doctor in that?
One of the biggest issues with technology, I'm sure you've heard of the technology paradox, right? Technology has so much promise, and then when it comes to implementing it and getting it on the
Yeah.
ground, it just doesn't take off, right?
Yes.
And I think a lot of that has to do with, firstly, people accepting the technology, doctors such as myself being open to the idea of artificial intelligence and being able to adopt it, and having the energy and the foresight to understand that this is something that I need to put energy into and learn.
Yeah.
And that's kind of what they say. AI won't, I don't think, will replace doctors, but doctors who don't know how to use AI will definitely be replaced in the future.
It's in every field.
Yeah,
I think you have a
absolutely.
very valid point that I also used to say that it's somebody who doesn't know how to use AI
Yeah.
because they're making how effective it is.
Absolutely. But I think there are a few things that are on our side now. So obviously our security measures are much more high tech now. Also, the fact that we already have an electronic health record in the system in the hospitals. I know it didn't really deliver, and EHRs sometimes are the bane of doctors' lives and actually ended up increasing their workload instead of decreasing it. But we have better ways now to integrate different software solutions into that EHR record. And I think that in itself, plus people being able to adopt it, plus the training programs in order to train us how to use it and to show the huge impact that this can have in our future healthcare. I think we're in a better situation now in order to be able to implement, adopt, and find the benefits out of AI in healthcare.
Well, that's really great, and it's very nice to listen all those experiences from you for the technology and healthcare perspective.
Thank you.
Thank you so much.